In today's video, we will demonstrate the condition of varicose veins. This is typically exemplified with the limbs exhibiting swollen or enlarged veins. The easiest way to spot this is the dark color of the veins, which will show up. As you can see here with our patient, the veins are either largely normally purple or blue. In our case, slightly purple. Sometimes they protrude out with a sort of bulging appearance. In our case, it's quite flat. There's no sort of bulging appearance being exhibited. So just to give you a background to this condition, the telltale signs are normally swelling ankles or feet, heavy legs, burning sensation in the legs, or even cramps. Dryness on the spot. This is where it is worse, particularly in the summer period, where you're more likely to sort of experience dryness. So the causes of this condition are largely to do with the small valves that exist inside the vein. So these basically carry blood to the heart. What happens is that if this flow is impeded, the blood will basically flow backwards. So it is the small valve malfunctioning that causes this condition, whether they worsen or become damaged. This causes the blood to aggregate in the veins, thus causing the swelling condition that typically characterizes this condition. So what can cupping do in this particular state? So what we will do is we'll use a needle to penetrate the vein. The needle has a sort of a deeper focus than a cut along the skin. The result will be that the blood inside the vein, which has accumulated, will hopefully be released. We use a needle as opposed to the typical Bic blade that we use, because we want to control the blood flow coming out, which should come out in a measured, controlled manner, which the needle allows us to achieve. So as you will see now, we're just applying some antiseptic spray. The blood is coming out straight away. It's very dark. So there's more veins, varicose veins on the side. So if you're going to attempt this, then please ensure the patient is sitting down and not standing. So the blood comes out almost immediately. And notice it's a very dark color. And this should typically be attempted every 3 months. And the results are normally, very positive. The condition, the varicose vein condition, the dark blue coloration is pretty much completely removed. Yep. So the key thing here is that we needle the right place, only the affected vein. We're not just sort of randomly doing multiple needles, applying multiple needles or cuts randomly. We're targeting the dark blue, dark purple veins, which we see the outline of. So cupping is actually quite an effective method with this condition. The methods in the West that are normally employed are threefold. One is called endothermal ablation. This is where the veins, the affected area, is sealed with heat. Another is where it's actually sealed with a foam-like substance, and this is called cellular therapy. The third is ligation and stripping, and this is basically a surgical procedure to remove the vein. In many cases, this is applied for cosmetic reasons. So the high risk category groups of persons, people that are affected with this condition, are largely of the female gender, or people with a history of this condition, i.e. it's hereditary, patients with a high BMI, if one of the veins is clotted with blood, this is known as deep vein thrombosis. Another factor also for high risk category groups is having previous injuries in the leg, being pregnant, older patients, and of course persons whose occupation entails standing up for long periods of time, which affects the circulation of blood throughout the body. If you are advised to visit a specialist, they will typically advance you through a duplex ultrasound, which utilizes sound waves which have a high frequency. This basically reveals the blood flow in the legs. So visibility sort of provides some visibility, a picture, if you like, of the blood flow and where it's being impeded in the veins. As a general rule, in terms of preventing this condition, I mean, if you fall into one of the high risk categories, in some cases there's very little you can do. For example, if you're a woman with a history in your family with this condition, but the general guidelines are to exercise, to sort of be mobile, to not remain standing for more than 30 minutes, or sitting in one posture for 30 minutes, etc. If you're working, do utilize the the screen break that is actually enforced by law that you're entitled to. Get up and go for a coffee regularly, or just move your limbs, etc. Don't sort of remain stagnant, or static rather. Okay, so as a result of needling, there is a slight scar, as you can see, and this will be gone after a few days. In fact, needling has the least impact in terms of scarring the skin. This isn't dangerous at all, so there are no negative effects through trying this treatment. So we're largely doing this for demonstration purposes, but in this case, both the cupper and the patient are one and the same. Otherwise, our cupping expert would be spending some time on the patient to clear all of the affected varicose veins visible on the leg. So the needle we're using, a question we're often asked, is actually a diabetic needle. It's just do a close up on it. I would say it's probably about half a centimeter long, 4 millimeters to be precise. And this isn't very painful for the patient. I mean, there might be, because particularly this side of the leg. So, I mean, I did mention that this condition affects typically the limbs, the arms, legs, hands, but it's not just the lower section of the leg. It can actually go all the way up to the top part of the leg as well. So we're just putting the seal back on the needle. And we're going to apply a cotton bud just to clean the affected area with antiseptic spray. see already. I can see the varicose veins we saw before this session. I can see that they're not as visible as was previously. So the the needling process has had almost immediate effects. Okay, thank you.